You know, we have different types of catarrh. There's one we call sinusitis. I know people will attack me for this, but what you concern me? Let's go on. Now, in sinusitis, there's an inflammation of your paranasal sinus. This is this. You see this place here, here, and this place. I'll just put the picture. You'll be able to see the picture. So when those places are inflamed, sometimes you feel pain, sometimes you feel feverish, and of course you have this nasal congestion. You are not able to breathe properly through your nose, right? And you're feeling that pain. What are you going to do in that kind of situation? Because we are now in harmattan season, right? And a lot of people are suffering from sinusitis. They're everywhere. So what are you going to do now? There are two ingredients that you need when it comes to treating sinusitis. So the first one is, of course, you need painkillers because those are inflammations of the sinus. Those are inflammations. So you need steroids or non-steroid anti-inflammatory drugs. So you need steroid anti-inflammatory drugs and non-steroid anti-inflammatory drugs. That's one. Number two, you need nasal decongestants. Does it make sense? Now, you need drugs like NSAIDs, ibuprofen or paracetamol. I will advise young, vibrant people. You know you don't have hypertension. Please go for NSAIDs. You don't have ulcer. Go for NSAIDs. The recommended NSAID is ibuprofen because it is short-acting NSAIDs, right? So you need ibuprofen or paracetamol. And if you are old, please, you are elderly, don't use diclofenac or ibuprofen. Just use paracetamol. That's the first thing you need to treat sinusitis. Then the second thing you need is pseudoephedrine. Now, pseudoephedrine is a nasal decongestant. It means those blockage you have in your nose, it's able to release all those things. Do you understand? It acts like it has this adrenergic effect on the body. So if you have hypertension, please, you use this pseudoephedrine with caution because it has ephedrine. So it has the ability to increase your blood pressure. It has the ability to increase your risk of getting a heart attack. If you have BPH, benign prostate hyperplasia too, please don't use pseudoephedrine. It can cause urinary retention. You understand? Because most drugs that are used for BPH, like tamsulosin, you understand, it dilates the vessels, while this pseudoephedrine will constrict it. Does it make sense? If it even makes sense, which I talk about. So those are the two ingredients you need. You need a painkiller and you need pseudoephedrine. Now, a lot of people who have sinusitis, they find it hard. They don't get better because they are taking the wrong dose of pseudoephedrine. Pseudoephedrine for adults, I'm talking about adults, always. For children, you go and meet your doctor. For adults, you need 60 milligram 4 times daily. 60 milligram 4 times daily. You see a lot of drugs, they have 30 milligram. So, but you need 60 milligram daily. So don't forget. I've seen a lot of combination with paracetamol and pseudoephedrine. Paracetamol, that's the two combination I usually see. And then sometimes, if allergy is what caused that nasal congestion, that's when you need drugs like tripolidine. It is a sedative agent and it works perfectly. So you just take it at night and you just crash and sleep. Or you can use purotine, that's chlorpheniramine, or you use diphenhydramine. So any of these ingredients I've called should be contained in your medications for sinusitis. So whenever you are giving any medication, just carry and don't look the ingredients. Remember what the pharmacist Alfred tell you. Okay, there's pseudoephedrine there. I'm supposed to be taking 60 milligram 4 times daily. There's paracetamol there for the pain, or there's ibuprofen for the inflammation. So those are the things you should know when you want to treat sinusitis. Okay, please leave a comment. Do you know if you leave a comment, the video actually goes viral? If you don't, it's practically useless. Don't just leave a comment. At least talk say you don't agree, or talk say you agree, or thank you. But leave a comment every time. Thank you.